Hey everyone, welcome back to the channel. Did you know that about 1% of the population may be living with schizoid personality disorder? This often overlooked condition affects more people than you might think, and it's time we dive into what it really means. Today we're talking about schizoid personality disorder, or SPD for short. It's a term that you might not hear very often, but is super important to understand, especially in mental health discussions. SPD is often misunderstood, and people who have it may struggle considerably in their daily lives. By shedding some light on this disorder, we can better support ourselves and others. So let's break it down. Now, let's talk about the challenges that come with schizoid personality disorder. For many people with SPD, social interactions can feel overwhelming or even unnecessary. Imagine feeling detached from the world around you, like you're watching life from a distance. This is the everyday experience for individuals with this disorder. Social isolation is a biggie. Many individuals with SPD prefer solitude and can feel uncomfortable in social situations. They often have few, if any, close relationships, and this can lead to loneliness. Emotional detachment is also common. They might struggle to express their feelings or even recognize their own emotions. This can create a barrier in personal relationships and make it tough for friends and family to connect with them. Living with schizoid personality disorder means facing these challenges day in and day out. It's not just about being shy or introverted, it's a profound sense of disconnection that can affect many aspects of life, including work and personal fulfillment. Let's dive deeper into the symptoms and potential causes of schizoid personality disorder. Symptoms can include a lack of interest in social relationships, a preference for solitary activities, and emotional coldness. Yep, that's right. People with SPD might seem indifferent to praise or criticism, which can come off as aloofness. As for the causes, researchers believe that a mix of genetic, environmental, and psychological factors play a role. For some, early childhood experiences can shape their emotional development. It's important to note that SPD is not caused by any one thing. It's a complex interplay of various influences. This disorder can really impact daily life. Imagine trying to navigate a world that feels overwhelming, while also feeling like you don't quite belong. Many people with SPD may excel in solitary jobs, but relationships can suffer. It can be heartbreaking for loved ones who want to connect but don't know how. The effects on relationships are profound. Friends and family might feel shut out, leading to misunderstandings and frustrations. It's crucial for those around individuals with SPD to be patient and understanding. Let me share a powerful story that highlights the impact of schizoid personality disorder. There's a guy named Alex. He's a talented artist who loves creating but struggles with his emotions. Throughout his life, he felt different from his peers, often preferring to spend time alone in his studio. One day, after months of isolation, a friend reached out and invited him to a gallery opening. Alex wanted to go but felt a wave of anxiety wash over him. Despite his fears, he decided to attend. When he arrived, he felt overwhelmed by the crowds and noise, but as he walked through the gallery, he saw people admiring his artwork. In that moment, something shifted for Alex. He realized that while he valued his solitude, he also craved recognition and connection. That night sparked a journey for him. He began to find ways to express his feelings through art and slowly opened up to his friends about his experiences. Alex's story is just one example, but it shows how understanding and support can make a difference for those grappling with schizoid personality disorder. So, to wrap things up, schizoid personality disorder is a complex condition that often leads to social isolation and emotional detachment. Understanding the symptoms and challenges is crucial, not just for those living with SPD, but for their loved ones as well. By fostering awareness and compassion, we can help break down the barriers that keep individuals with this disorder from feeling connected and understood. Treatment for schizoid personality disorder typically involves psychotherapy. Cognitive behavioral therapy, or CBT, can help individuals identify and change negative thought patterns and behaviors. Group therapy can also be beneficial, providing a safe environment to practice social skills and build relationships. Medications, such as antidepressants or antipsychotics, may be prescribed to manage symptoms like anxiety or depression, though they are not a primary treatment for SPD. What are your thoughts on schizoid personality disorder? Have you or someone you know experienced similar challenges? Drop your comments below and don't forget to check out my other videos on mental health topics for more insights. Thank you for watching and see you next time.